Niacin's fall from grace, from a life-saving, Nobel-era discovery to a largely forgotten molecule overshadowed by flashier NAD precursors, is a cautionary tale of how side effects, medical fads, and marketing inertia can obscure a molecule's enduring scientific value. This reputation problem is rooted in a mix of historical baggage, misunderstood side effects, and shifts in medical and consumer priorities, rather than any inherent flaw in niacin itself. First, niacin's clinical use exploded in the mid-20th century after it was recognized as the cure for pellagra, a fatal disease of NAD deficiency that ravaged populations reliant on corn-based diets. This established niacin as one of the most essential vitamins in human history. Thousands of lives were saved once niacin fortification programs became standard. But niacin's remarkable power to reverse a deadly deficiency faded from public consciousness as pellagra disappeared from industrialized societies, relegating niacin to an old vitamin status, associated more with nutritional minimums than proactive health. In the 1950s and 60s, niacin reemerged, this time as a high-dose therapy for cholesterol management. It became the first lipid-lowering agent to demonstrate reductions in cardiovascular events in large randomized trials, decades before statins were introduced. But high-dose niacin came with the notorious niacin flush, an uncomfortable, sometimes alarming sensation of warmth, redness, and tingling due to prostaglandin-mediated vasodilation. While flush is benign and even mechanistically linked to beneficial pathways, GPR109A activation, it rapidly became niacin's defining feature in the public eye. Pharmaceutical companies tried to manage it with slow-release formulations, but these sometimes caused liver toxicity due to altered pharmacokinetics, giving niacin a reputation for being both uncomfortable and risky. Compounding this, niacin's marketing in the late 20th century leaned heavily on cholesterol lowering, but the arrival of statins, which offered superior LDL reductions with simpler dosing and fewer side effects, pushed niacin aside in the eyes of doctors and patients. Even when niacin was combined with statins, studies like AMHI and HBS2 Thrive produced mixed results, in part because of trial design flaws or underpowered endpoints, but also because the bar for new cholesterol therapies had been raised by statins' blockbuster success. Meanwhile, in the nutritional world, niacin never benefited from the trend-driven marketing that elevated other vitamins and supplements. Unlike vitamin D, rebranded for immune and mood health, or vitamin C, marketed for colds and skin, niacin's association with flushing, outdated cholesterol management, and a disease, pellagra, few had ever seen kept it stuck in a historical time capsule. This perception made it ripe for displacement by new, designer NAD precursors like NR and NMN, which capitalized on longevity buzzwords, mitochondrial hype, and sleek branding, despite niacin's robust clinical record and its identical end product, replenishment of NAD. Compounding this erosion of reputation is the widespread misunderstanding of niacin's side effects. The flush is often portrayed as a dangerous reaction, yet it's a transient, reversible sign of prostaglandin activity, which may itself contribute to improved microvascular function and anti-inflammatory effects. Similarly, concerns about liver toxicity often stem from specific sustained-release niacin products taken without proper monitoring, not from immediate-release niacin or modest dietary supplementation. Over time, these misinterpretations calcified into blanket stigma, overshadowing the nuance around formulation, dosing, and individual patient context. Ironically, niacin remains one of the best-studied NAD boosting molecules in humans, with proven efficacy not just in correcting deficiency, but also improving metabolic and cardiovascular markers. It engages unique pathways like GPR109A, which NR and NMN cannot touch, and can be produced cheaply and sustainably, making it globally accessible. Yet these scientifically compelling features rarely surface in modern conversations, drowned out by marketing narratives positioning NR and NMN as sleek, next-gen molecules. In this sense, niacin's reputation problem is a tragic case of scientific amnesia. The modern health and supplement world has abandoned a molecule that saved millions of lives and still holds immense biochemical promise. The fact that many practitioners and consumers overlook niacin when considering NAD restoration is less a reflection of its utility and more a testament to how marketing narratives, historical side effects, and a shifting medical landscape can relegate even the most foundational nutrients to obscurity.